This presentation will focus on the results of the research that was performed at the Global Health Network at the University of Oxford on Ebola and Twitter lessons learned. Twitter is an online social networking and microblogging platform that enables users to send and read short 140-character messages called tweets. Twitter is used for a variety of reasons in the global health field. Firstly, it may be used as an early warning outbreak detection system to inform health authorities in real time. The general idea is that the frequency of tweets on a particular topic approximates interest in a given public health topic. For example, it has been demonstrated that Twitter data may substantially improve the prediction of emergence and spread of influenza, not only at the national or regional level, but also at the city level, as it has been done in New York City. However, the ability of Twitter to predict and track infectious diseases depends on several factors, among which are the Twitter penetration in a studied location, public awareness about the disease of interest and its risk factors. For example, if it is a rare or new and unknown disease, people would not tweet about it. The age group that the disease affects. For example, if it affects young children or older population who are not Twitter users, they will not use the platform to tweet about the disease. The other factor is social perception of the disease. For example, the diseases that are stigmatized in the society, such as sexually transmitted diseases, are less likely to be publicly discussed on social media by affected people. It is also important to account for seasonal factors that may influence the frequency of tweets on a particular topic. Twitter conversation might also be highly influenced by contextual factors and high media interest. It is also important to consider how easy it is to identify tweets about the disease of interest. For example, if it is relatively easy to identify tweets about flu and its symptoms, it might be more difficult to identify the tweets about cardiovascular diseases and mental health conditions. Therefore, Twitter surveillance is a promising addition to conventional means of warning of emerging outbreaks and may provide information in real time, unlike traditional surveillance systems with the reporting gap of 1 or 2 weeks. Secondly, Twitter may be used for health communication and information dissemination. For example, it is possible to communicate information about a specific disease to the public on Twitter. For example, diabetes or sexually transmitted diseases. It is possible to provide information on the risk factors, specific use to action, and benefits of a healthy behavior. In emergencies, Twitter might be the fastest way for the information to reach the public and to build situational awareness at the time when a disaster occurs. Via Twitter, authorities might inform the public where to seek shelter or where the vaccination is provided. Thirdly, Twitter may be used for understanding public health concerns. For example, the Chicago Health Department in the USA used Twitter in order to identify and respond to complaints about possible foodborne illness, providing a link to fill out a formal complaint form. This intervention was followed by an inspection of the mentioned restaurants and helped to identify the places that did not meet the safety criteria. Twitter may also give insights to public health authorities about people's opinion and sentiment about health policies that are either being prepared or have been put into place. Moreover, during the emergencies, Twitter data may help to identify the area of the accident. Ebola virus disease is an often fatal disease in humans caused by Ebola viruses, and it develops a severe form of hemorrhagic fever in humans. The West African Ebola outbreak is the most complex and the largest since the discovery of Ebola virus in 1976. Unlike the previous outbreaks, which affected remote villages in Central Africa, this one has affected major urban as well as rural areas. It was identified that the first case of this epidemic was located in Guinea, and it dates back to the 26th of December 2013. The outbreak was declared a public health emergency of international concern by the World Health Organization on the 8th of August 2014. Sierra Leone, Liberia, and Guinea are the most affected countries in this outbreak. Up to the 2nd December 2015, there were more than 28,000 reported cases and more than 11,000 deaths of Ebola. Despite the level of poverty in the countries most affected by the Ebola outbreak, the use of tablets, computers, and smartphones in these regions is increasing, which creates an opportunity to communicate public health information on social media. For example, Nigeria, the most populous country in Africa, has approximately 2 million Twitter users. Since the beginning of the Ebola Twitter conversation, it has been noticed that a lot of misinformation about Ebola is being spread on the platform. Among the tweets from Guinea, Liberia, and Nigeria containing the words Ebola, cure, and prevention, in the first week of September 2014, more than half contained misinformation. Among the most common misinformation were the messages that Ebola can be treated by blood transfusion or by drinking and washing in salty water. The latter rumor even caused 2 deaths at the beginning of August 2014 in Nigeria. It had been demonstrated that the global Ebola Twitter conversation did not correlate with the real-world trend of the virus itself, but was initiated by media attention and reacted to the Ebola mainstream media coverage. For example, on the left graph, we may see the comparison of the Ebola Twitter conversation from the beginning of August 2014 to the middle of September 2014. It is demonstrated as an orange area. So it's compared with the Ebola disease deaths in red line. We may see that they don't correlate with each other. Whereas on the right graph, it is demonstrated that some of the Ebola news headlines caused spikes in Ebola Twitter activity. The rationale behind my study was to assess the ways in which Twitter was used during the West African Ebola outbreak by the general Twitter population, as well as by the World Health Organization and the US Centers for Disease Control and Prevention, in order to better inform future efforts to harness the public health potential of Twitter. The dataset in this study consisted of more than 60 million tweets from Twitter firehose. This means that it was collected against the filtering criteria from the full Twitter data sample. The dataset covers the period of more than 17 months from December 2013 to May 2015. I used the following filtering criteria in order to identify the relevant data. Firstly, I included all the tweets containing the word Ebola in Latin script. Secondly, I identified the most relevant hashtags about Ebola virus disease. And thirdly, I included the tweets containing the URLs to the articles that had the word Ebola in their title, description, or among their keywords, but not necessarily mentioning the word Ebola or one of the hashtags in the tweet text. Data management and analysis were performed on a platform for machine data analysis, Splunk. The first research question of the study aimed to investigate what the pattern of Twitter use in the general Twitter population during the West African Ebola outbreak was. My analysis has revealed that tweets in the dataset were posted in 149 languages, and that the Ebola Twitter conversation was not as prevalent in Asian countries as in English-speaking, European, and possibly Latin American countries. 1.2% of the tweets in the study dataset were geotagged with precise location. Geographical mapping of the geotagged tweets demonstrated that most of them were posted from North America, Europe, and Latin America, with a substantial proportion of tweets, approximately 14%, coming from West Africa at the beginning of the outbreak, before the first Ebola case was tested in the USA. However, it should be considered here that only 1% of tweets was included in this graph, and these were tweets posted from mobile devices. On this slide, we may see the tweet frequency distribution over the whole study period. It could be observed that the frequency level increased at the end of March 2014 and reached its peak over October 2014. Comparing tweet frequency distribution with the total number of reported Ebola cases and deaths over time, and new confirmed Ebola cases in 3 most affected countries, we may see that the Ebola conversation on Twitter did not correspond with the Ebola virus disease epidemiology. However, and not surprisingly, tweets did correspond with Ebola news events. As we may see on this graph, the Twitter conversation was initiated on the 22nd of March 2014, a day when a mysterious hemorrhagic fever in Guinea was confirmed as Ebola, which was followed by the release of the first WHO report concerning the Ebola outbreak in West Africa. The frequency of tweets increased at the end of July 2014, 2 days before the first Ebola case was tested and officially confirmed in Lagos, Nigeria. The tweet frequency was rapidly increasing further when 2 US missionary workers infected with Ebola were evacuated to the US from Liberia at the beginning of August 2014, and when the WHO declared the Ebola outbreak a public health emergency of international concern. Tweet frequency reached its peak at the beginning of October 2014, as we may see on this graph, after the first Ebola case was diagnosed in the USA on the 30th of September 2014, and demonstrated significant peaks throughout October 2014, when the first Ebola-infected patient died and when 3 more Ebola cases were diagnosed in the US. Here it's interesting to notice that about 40 million tweets out of 60 million tweets in the dataset were posted over October 2014. Twitter conversation started to gradually drop since the beginning of November 2014. It's also important to mention here that in order to identify and confirm the events that caused growth in Twitter Ebola conversation, it was possible to look at the top 20 most shared articles during the period of interest. And the most prevalent topics of these articles suggested that the Twitter public mostly reacted to these news events. For example, on the 8th of August 2014, 10 of the top 20 most shared articles were about the news that the WHO declared Ebola outbreak a public health emergency of international concern. Therefore, using big data analytics tools, it was possible to quickly identify which news stories drew public attention in the Ebola Twitter conversation. The next question of this project aimed to understand how Twitter users were engaged in the Twitter Ebola conversation. Well, first of all, we should understand what Twitter engagement is. Twitter engagement is the interactive, synchronous communication and collaboration among numerous participants via Twitter. Twitter users may engage with other users by retweeting their tweets, by mentioning them, sending them direct replies, or favoriting their tweets. I measured these parameters in the study dataset in order to evaluate the overall engagement of the Twitter public in the Ebola Twitter conversation. So on this graph, on the bottom we may see a graph demonstrating the prevalence of tweets and retweets, mentions, and replies among them in different colors. The overall prevalence of mentions in the study dataset was 61%, and the overall prevalence of retweets was 48%, which is higher than that in non-thematic Twitter datasets. This suggests that Twitter users were overall more engaged in the Ebola conversation and that they were more likely to share information with other Twitter users in comparison with the general Twitter conversation. In every studied period, more than half of retweets contained URLs, with the exception of October 2014, when Ebola cases were diagnosed in the US. Although the prevalence of retweets was the highest then, the prevalence of retweets containing URLs among them was only 19%. This suggests that Twitter users were more likely to retweet information and news during the Ebola outbreak in comparison with the general Twitter conversation. In October 2014, however, Although users were frequently retweeting other users, their tweets were less likely to contain the links to news stories or other information articles. The prevalence of tweets containing replies in the study dataset was 6.6%, which is much lower than that in non-thematic Twitter datasets. This suggests that when the retweeting level was relatively high, direct engagement between Twitter users with regards to Ebola topic was relatively low. In order to discern the key players involved in the Twitter discussion surrounding the West African Ebola outbreak, I identified accounts that achieved the highest level of engagement with other Twitter users during this period. For that, I examined the top 20 most retweeted and mentioned accounts, the top 20 accounts which received the highest number of replies, and the accounts that posted the top 10 most retweeted tweets. Accounts of news organizations achieved the highest level of Twitter engagement. This suggests that people were sharing news stories and actively sought information on Twitter, and supports the fact that Ebola conversation on Twitter corresponded with news events. This highlights the importance of Twitter as a tool for rapid communication and information sharing during epidemics. This is also a lesson for health authorities that in future outbreak scenarios could consider tracking the information provided by these organizations and collaboration with them. Interestingly, the next group of accounts that achieved a high level of Twitter engagement were humor accounts. These are accounts that are stated in their description that they share humorous content. Their number was especially high in the study period over October 2014, when Ebola cases were diagnosed in the US, which might explain why the prevalence of retweets containing URLs in this period was relatively low. Users were sharing humorous content rather than news and information. Although there are a number of humor accounts which have millions of followers on Twitter, some of the most retweeted humor accounts were created during the study period, with Ebola as a specific focus of their tweets, and did not have many followers when their first tweets were posted. Humor accounts' popularity in the study might be explained by the general popularity of Ebola as a topic for Twitter conversation, and by the increased concern of the general public and Twitter users on this issue. Reading and sharing humorous content on Twitter might have acted as a means for relief and tackling anxiety, as it is known that humor, even dark humor, is used in stressful situations as a buffer. Nevertheless, I have not examined what the actual content of tweets posted by humor accounts was. It might have not always been humorous content. For example, it has been reported that one of these accounts retweeted a public health information tweet posted by CDC and received a higher number of retweets than the most retweeted tweet posted by CDC itself. This can be explained by a higher number of followers that this humor account had in comparison with the CDC account. Therefore, the issue of content posted by humor accounts should be investigated further, and their ability to spread public health or other accurate information should be further explored. Twitter celebrities and celebrities also achieved a high level of Twitter engagement. Twitter celebrities are the accounts of people or organizations that are not famous outside of Twitter's sphere, but have a high number of followers on Twitter. Among them were health specialists, journalists, or bloggers who actively use Twitter for communication with the public. This suggests that these accounts have high influence in the Twitter sphere during the outbreak periods. Some of the most retweeted tweets posted by them contained humorous content and personal opinions. Accounts of celebrities also achieved a high level of Twitter engagement, most likely due to the high number of followers and reputation they have on Twitter's sphere, which also demonstrates their potential to spread the information during public health emergencies. Many UN organizations already collaborate with celebrities, appointing them as goodwill ambassadors in order to attract attention and focus the world's eyes on organizations' goals. Public health organizations may consider the possibilities of closer collaboration with the accounts of news organizations, Twitter celebrities, and humor accounts that have such a high reach and level of engagement with the general Twitter population during public health emergencies, especially in the periods when the public expresses high level of anxiety in the case of humor accounts. I further studied what were accounts of governmental and non-governmental organizations that also achieved a high level of Twitter engagement. Accounts of the WHO, UNICEF, CDC, and White House were among those that achieved the highest level of Twitter engagement over the whole study period. This suggests that Twitter users turned to them in order to seek the information during the Ebola outbreak. Whereas the WHO and UNICEF accounts were the sources of information for the global community, the accounts of CDC and White House provided the information for the US public. However, none of the tweets of these organizations managed to receive the highest level of attention over the study period and was not among the most retweeted tweets in the dataset. I further explored how the WHO and CDC used Twitter during the West African Ebola outbreak and what level of engagement they achieved with the general Twitter population in relation to this outbreak. Both the WHO and CDC were among the accounts that achieved the highest level of overall Twitter engagement. And for example, on these graphs, we may see that the WHO was the third most retweeted account, whereas both the WHO and CDC were among the top 10 most mentioned accounts in the whole dataset. They were of interest for this study as these organizations participated in Ebola response at the global scale and they used Twitter as one of their official communication tools. CDC, being a US health agency, also managed the Ebola cases and public anxiety in the US, the country whose citizens seem to have the highest contribution to the Twitter conversation about Ebola. The geography of tweets mentioning these accounts also demonstrated the geography of public interest in them. On the slide, we may see that the WHO account was mentioned globally, whereas the CDC account was mainly mentioned from the US. Exploring the public engagement with the WHO and CDC accounts, I observed that the growth in the number of their followers increased more rapidly when key Ebola news events happened. As we can see on this slide, the number of followers of the WHO account increased when first Ebola cases were tested in Nigeria at the end of July and in the USA at the end of September. The number of followers of the CDC Twitter account grew more rapidly when first US patients infected with Ebola were transported to the US from West Africa and when the first Ebola case was diagnosed in the US. This again suggests that public turned to the accounts of these organizations to seek information during the Ebola outbreak. I explored Ebola Twitter activity of these accounts over the study period and compared it with the timing of the Ebola-related events that drew public attention to the accounts of the WHO and CDC. These events are presented on this slide. Observing tweet frequency distribution of the WHO account and studying the content of the posted tweets, I identified disproportionality in the time frame of the information provision by the WHO and of the general Twitter public seeking the information. For example, in October 2014, when Ebola cases were tested in the USA and the US public expressed fear and anxiety, WHO, their tweets are in blue, WHO did not demonstrate a high level of Twitter activity related to Ebola. Nevertheless, in this period, the public also turned to the CDC Twitter account and CDC, whose tweets are in yellow, the frequency of tweets. And the CDC quickly responded to them. Thus, the highest level of the CDC Twitter activity was related to its 4 Twitter chats on Ebola, which were organized in August 2013. When first American patients were transported to the US, and in October 2014, when the first case was tested in the US, and the highest prevalence of the tweets containing public health messages was also observed at this time. So the time when the US public expressed the highest interest and the highest level of anxiety. The most retweeted WHO tweet was posted on the day when the first Ebola case was diagnosed in the USA. It contained an emotional personal story and was retweeted more than 3,000 times by the end of the study period. The fact that the personal story generated more Twitter engagement than public health messages suggests that the Twitter public demonstrates high engagement with emotional and human content, rather than messages containing official information. The most retweeted CDC tweet was also posted when the first Ebola case was diagnosed in the USA at the end of September 2014, and it contained public health information and was retweeted more than 4,000 times. Interestingly, the most retweeted tweet in the whole dataset was posted by a Twitter celebrity who had just around 2,500 followers. This tweet contained a political statement expressed as a joke and was retweeted nearly 63,000 times. Considering the relatively low number of followers that the account had, this tweet was likely retweeted due to its controversial content that attracted people's attention. This suggests that the combination of emotional content with important public health messages could help public health organizations to achieve even higher levels of engagement with the Twitter public. In conclusion, Twitter activity during the recent Ebola outbreak was more likely to coincide with news events covered by mainstream media rather than disease dynamics. Twitter provides a unique opportunity for public health organizations to listen to their audience and to share scientifically accurate information. Health authorities would benefit from building their Twitter presence because, as has been demonstrated in the example with the Ebola outbreak, people turn to the accounts of these organizations in order to ask questions and obtain accurate public health information. Public health organizations may benefit from employing humorous and emotional content and collaborating with accounts with a high level of Twitter engagements, such as news, humor, Twitter celebrities, and celebrities accounts. It is also important for them to monitor how accurate the information posted by these accounts is. Health authorities could consider the use of big data analytics tools in order to quickly gain insights from social media data to inform their communication strategies. I also would like to acknowledge that this work would not have been possible without Splunk for Good corporate social responsibility program of Splunk. Thank you.